I personally feel that the best predictor of a long-term response in myeloma is the practice of stem cell transplantation. In our single-center experience, we just reviewed and published that information of more than 200 patients with myeloma treated in a single institution in a developing country. We were able to show that the best predictor of long-term survival was the practice of autologous stem cell transplantation, irrespective of other markers of the disease. So this indicates that despite the fact that you include patients with poor risk myeloma, the practice of the autologous stem cell transplantation is probably the best treatment for this type of patients. And I think that this finding that we made in our single center experience has been made also in some other centers, proving that, as I said, the autologous stem cell transplantation is the best treatment for myeloma and the best predictor for a long-term response. It is also interesting to mention that for some reason, probably genetic, the course of the myeloma in Latin Americans is a little different than what we see in colored individuals or in Caucasians. This indicates that probably the prognosis in patients with myeloma in Latin America is better as compared with the other populations, and even in those patients with a relatively good prognosis in myeloma, doing stem cell transplantation is associated with a better long-term results. So I'm strongly convinced that the best treatment for patients with myeloma is autologous stem cell transplantation, and that there are very few cases in which stem cell transplantation cannot be done.